Hi, I'm Jen from JenThereDoneThat, and for those of you that are new to my channel, I've been quite ill for the last couple years. So that means I've been to the doctor quite a bit, specialists, tons of lab appointments, imaging, x-rays, and a couple months ago, I even had surgery. So here are all the things that I wish I had known about healthcare in Puerto Rico before I moved here. As soon as you move to the island, you can get Puerto Rican-based health insurance. So when I first moved here, I investigated and researched a few different insurance companies, MCS, Humira. I ended up going with SSS, which is the Blue Cross Blue Shield of Puerto Rico. I had Blue Cross Blue Shield PPO back in the States, in Arizona, and I was paying over $350 a month for my coverage. It was not a great plan. I'm self-employed, so it was high deductibles, high copays, and limited coverage. Here on the island, I pay $180 a month for low deductibles, low copays, and high coverage. I'm very pleased with my plan, and it has been really easy to use. It also includes dental. Not all of the plans do, but be sure you ask when you're signing up for your insurance plan. The hardest part is finding your primary care physician. I went through quite a few in the beginning, just trying to find the right fit for me. I started going through the online directories, calling, and trying to make appointments that way. Most of those are outdated. Even before Hurricane Maria, the healthcare provider directories are woefully outdated. So that may look like there's a lot of doctors within your network close by. They're probably not. Most of them don't have websites. It really is difficult to find your primary care physician. I ended up going with the Salus Clinic offered by SSS to find my primary care physician. Since then, I've actually switched to a concierge plan, and I've got a new primary care physician from them. But finding that primary care physician is the hardest, and it's the first step. Once you have a primary care physician, they can help refer you to specialists and recommend imaging centers, laboratories, whatever you need for your specific medical needs. One of the very surprising things is the doctors, laboratories, etc. Many of them don't take credit cards, so always be sure to have cash with you. My first primary care physician was cash only, cash or checks. I never carry my checkbook around, so that was a big surprise. Many of the doctors around the island are cash, check, or ATH Mobile. Many do not take credit cards. So when you're making your appointment, be sure to ask if they take credit cards or if you need to bring cash. The good news is your copays are really low here, so the cash out of pocket is not a large amount of money. Most of my copays are $10, $15, or $20 depending on what doctor I'm seeing. There are medical concierge services, which I have Prevon Concierge. It is an additional annual fee on top of what you pay for your medical insurance. And they provide primary care physicians, annual visits, X number of appointments per year, some labs. They provide coordination. If you are like me and you've had some medical issues, you have specialty prescriptions, you've got an upcoming surgery, or you just have chronic health conditions, I do recommend going with, or at least researching, a medical concierge plan. They have been incredibly helpful to me, getting the right diagnosis, making sure that all of my pre-op and my post-op prior to my surgery were handled. They answered a ton of questions for me, and they really just hold your hand through the process. In the event of a medical emergency, they would be one of the first phone calls that I make after 911. They are not necessarily for everybody. It is absolutely not necessary for most normal people. If you are in good health, it's probably not necessary. But again, I've had a lot of health issues for the last couple years, and Pravon and my medical concierge have been a lifesaver, a literal lifesaver for me this last year. And I'm grateful to have had that additional level of care and support getting through the last year of health crazies. They do offer telemedicine, and again, with COVID, now SSS has telemedicine and a few others, but they were offering telemedicine before any of this madness even started. So they tend to be much more advanced technologically, as well as they have bilingual nurses and staff. If you are uncomfortable speaking Spanish, or like me, when I'm in pain or I'm tired, things don't necessarily process right, it's good to have that extra level. Most doctors on the island do not take appointments. That is pre-COVID. Now with COVID, more doctors are taking appointments, and I hope that they stick with the appointments. But one of the things to be sure to ask when you're calling is this when the office opens, or am I actually getting an appointment? Definitely ask that. Otherwise, you could be sitting around waiting 4 or 5 hours to be seen in the doctor's office. Some doctors have appointment windows, which isn't necessarily a bad thing. There may be a few people that have the same window as you, and you show up. If it's a 1 p.m. window, it may be a 1 to 3 or 1 to 2 p.m. window. Whoever is the first come, first served for that appointment window. Again, with COVID, they're being much better about actually having shorter appointment windows or appointment times, and many doctors are not even having you wait in the waiting room. They're having you wait in your car, and then they'll call you when it's time, so you can sit and enjoy some music and relax, or work or multitask or whatever while you're waiting for your appointment, instead of being stuck in a waiting room. One of the most important things I wish I had known before going to the doctor for the very first time is how to dress. It is freezing in those offices. They keep them so cold. So your normal t-shirt and shorts with flip-flops is not going to cut it. This is the time to break out your jeans and socks and shoes before going to the doctor. I even bring a cardigan or a long sleeve shirt to put on over my t-shirt when I'm in the waiting room or in the doctor's office. They keep it very, very cold, and you do not want to be sitting there waiting for your doctor appointment or the labs or imaging, and your lips turn blue because it's so cold. I know you don't think about that necessarily in the Caribbean, but because of how cold they keep these medical offices, I always remember to wear jeans, socks and shoes, and bring that sweater with me. And you will definitely be grateful that you brought it with you. One of the weird things is going to get blood work, imaging, or other labs. The results are sent to you, not to your doctor. In the States, your blood work, your lab results, everything would be sent directly to your doctor, and then your doctor would review them, and either you have an appointment or they would call you with the results. Here, the lab results come back to you as the patient. And a lot of times it's paper. Again, with COVID, we're seeing more of that electronic, so that's a very good thing. Be sure to ask when you go in and get any kind of blood work or laboratories or anything, will the results be, can the results be emailed to you or sent to you electronically? And more and more of the laboratories are doing that. There are still some results that they may have a stamp or a sticker for. I had a few tests recently that I still needed to go back in and retrieve them manually because they had an actual sticker or a stamp to certify the results. So be sure to ask. You will need to either make an appointment or telemedicine or something with your doctor and send them your results so that they have it in their records and they can review the results with you. Prescriptions used to be just paper prescriptions. Again, with COVID, one of the benefits we're seeing is that prescriptions are now being sent electronic. Some doctors were already doing this a couple years ago, but more and more doctors are doing the electronic prescriptions. They'll either email it to you or email it directly to your pharmacy. The big exception to that is opioids. They still require a handwritten paper prescription being delivered to the pharmacy. Many of you have asked, and medical cannabis is legal here on the island. It is a doctor's note and an application form to receive your medical cannabis license, and it's good for 1 year. A lot of the forms you fill out in the doctor's office may not be available in English, so this is a great time for you to brush up on your Spanish. Be sure to ask if they have the forms in English, but just be prepared. They may not have all of the medical forms in English, and you may be filling them out in Espanol. Google Translate is great for this, and I found that most of the office staff are very willing to help you fill those out if there's a medical term or phrase that you don't quite understand. So now that I've figured out medical care on the island, it's actually very good. I've had exceptional health care. My surgery just a couple months ago was incredibly low cost, and they did a wonderful job. So I'm really pleased with the level of health care I receive on the island, but it definitely was several years of trial and error to get to this point. So do you have any questions about medical or healthcare here on the island? Please leave those in the comments below, and I'll be sure to answer them in either a comment or future video. Thanks for watching. Be sure to like and subscribe for more videos from Jen There, Done That in Puerto Rico, the Caribbean, and beyond.